Okay. So in this video, we're going to talk about the cranial nerves. So cranial nerves are part of the nervous system, and specifically of the PNS, peripheral nervous system. So we have 12 cranial nerves that attach to the brain, and the first two, which are the olfactory nerve and the optic nerve, they connect directly into the brain, while the other ones, they connect indirectly. Now, so the cranial nerves are numbered by Roman numerals, so 1 through 12, and they are numbered according to the side where they are attached to the brain from anterior to posterior, with the exception of number 12, which is the last one. That one connects before number 11. So this is olfactory nerve number 1. This is the olfactory bulb, and this here will be optic nerve or cranial nerve number 2. Now cranial nerve number 3 will be this one in here. So this part of the brain is the pons, and this is cranial nerve number 3. Now cranial nerve number 4 is here on the side of the pons, and now this is cranial nerve number 5. Now cranial nerve number 3, before I continue, is called oculomotor. Number 4, it is trochlear. Number 5 is trigeminal, and it's just below. So as you can see, we start them from anterior to posterior: 1, 2, 3, 4, and 5. And then in here, between the pons, which is this, and the medulla oblongata, which is this, we have cranial nerve number 6, which is abducens. And then here on the side of abducens, we have cranial nerve number 7, which is facial nerve. And then in here, we have cranial nerve number 8, which is the vestibulocochlear. And then here we have cranial nerve number 9, which is glossopharyngeal nerve. And then in here, we have cranial nerve number 10, which is vagus nerve. And then in here, we have cranial nerve number 11, which is called accessory nerve. And this is the spinal root of the accessory. And then in here, we have cranial nerve number 12, which is hypoglossal. So again, starting from anterior to posterior will be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, and the accessory root of 11. Now let me talk to you about what they do. So some of them, they have a sensory function, and some of them, they have a motor function, and they can be mixed. So they can have a sensory function and a motor function. So sensory is when they detect any signal from the environment, and motor will be when they move something. So out of these 12 cranial nerves, we have some that are purely sensory, some of them that are mixed, and some of them that are purely motor. Examples of some of them that are purely sensory. So we have olfactory, which is number 1, which helps us to smell. And then we have optic, which detects the photons of light in their environment, though that's the one that makes us see. That's cranial nerve number 2. And then we have cranial nerve number 8, which is vestibulocochlear, that at some point, this cranial nerve number 8, together with optic and olfactory, are considered special senses. Now, some of them that are sensory and motor will be an example: trigeminal, which is cranial nerve number 5. Trigeminal help us to move the muscles of mastication, which is the temporalis muscle, the masseter, and also is sensory because it helps us to detect pain from the oral cavity. So for instance, when you have a toothache, you are stimulating one of the branches of trigeminal. So branches of trigeminal will be ophthalmic, the one that goes to the eye, maxillary, that ones that innervates the region of the maxilla, and then the mandibular that innervates the region of the mandible. And purely motor, we have example cranial nerve number 12 or hypoglossal. That one allows to move our tongue. So if someone has a paralysis of cranial nerve number 12, the person might have problem speaking because he won't be able to move his tongue. And vagus nerve is the longest cranial nerve. So let me just tell you briefly then how you can test them. So in order for us to test cranial nerve number 1, olfactory, you will have an odorant substance in one of the flasks. Ask the person to close its eyes, and then put the odorant next to the nose of the person and ask to detect what odorant you have put in there. So that's how you test for cranial nerve number 1. Cranial nerve number 2. The best way to test is just basically to ask if someone can see, but as long as if the person is blind, it's very likely that it has damage to cranial nerve number 2, which is the optic nerve. Probably I was saying number 1, but it's actually number 2, optic. So you can test that by asking someone to see an object, and if the person cannot see, very likely the person has a damage in cranial number 2. Cranial nerve number 3, oculomotor. That one innervates extrinsic muscles of the eye, like superior rectus, inferior rectus, medial rectus, and you will ask the person to follow an object. So up, down, and then medially. Now, cranial nerve number 3 also innervates this muscle that elevates our eyelids. So if someone cannot open their eye by elevating their eyelid, it has a paralysis of cranial nerve number 3. So that's the motor function of cranial nerve number 3, the oculomotor nerve. But also you can use this pen light to shine light into the pupil of the person, because this cranial nerve number 3 innervates these muscles of the iris, the radial muscle of the iris, and when you shine light in the person's pupil, you will have constriction of your pupil if there is no problem with this cranial nerve. And that's the way you test for cranial nerve number 3. Now for cranial nerve number 4 or trochlear, this one innervates the superior oblique muscle. So if the person won't be able to look down and out, the person has a problem with cranial nerve number 4. So you will ask by asking the person, follow my finger down and up, down and out. So if the person cannot follow your finger, that has a problem with number 4. For number 5, there are different ways. So one way to test for cranial nerve number 5, the motor function, is to grab the mandible of the person up and ask the person to open their mouth. So you're trying to close their mouth by keeping their jaw up, and they're supposed to overcome that resistance. If the person has a weak spot on either side, you might have damage to this cranial nerve number 5. Another way is to ask the person to clench a tongue depressor with their teeth and then try to pull it. So if the person doesn't have problems with cranial nerve number 5, you'll be able to hold it. Of course, you shouldn't be so rough and cause a problem. Now, another way to test is by having test tubes with water at different temperatures. Put it on the cheek side with the person's eyes closed and ask if he can sense the difference in temperature. Now, cranial nerve number 5 detects then temperature as well, and also detects pain. So if someone eats spicy food and the person get all, I don't know, spiced up or all uncomfortable while eating up this spicy food, that means that cranial nerve number 5 is functioning, because actually hotness in spicy foods, it is detected by cranial nerve number 5. It is not a taste, it is actually a sensation of pain. Now, cranial nerve number 6, or abducens, you test it by asking the person to follow your finger to the sides, because this one, abducens nerve, innervates the lateral rectus muscle, which make us to look to the side. So you will ask the person to follow your finger to the sides. Cranial nerve number 7 is facial nerve. This innervates the muscles of facial expression. So you can ask the person to smile, to frown. So that's the way you test it, by asking to produce some emotions now, or to show some emotions with their face. Cranial nerve number 9, glossopharyngeal. You ask the person to swallow their own saliva, and also you can feel here on the sides of the trachea as the person is swallowing, to see if the trachea moves a little bit up and down, because this nerve, cranial nerve number 9, innervates the muscles of the pharynx. So one way to test then is by seeing if the person can swallow saliva. Also, you can elicit the gag reflex with the tongue depressor, sticking it up into the base of the tongue, but if the person gags, that means that the glossopharyngeal is working, but there is not so much need of doing that. Cranial nerve number 10. There is no way to test it, because, I mean, at some point this cranial nerve number 9 innervates muscles, innervates actually not muscle, innervates the viscerae, like the heart, the abdominal viscerae, and at some point, if you stimulate this vagus nerve, you can depress the heart rate, and the person might have bradycardia. But as long as the person has a normal heart rate, or normal actually functioning of the abdominal viscerae, that means that it can digest, it can transport the food from the different portions of the digestive system. That means that the vagus nerve is functioning. So now for cranial nerve number 11, the spinal nerve. This cranial nerve innervates muscles of the neck and the back. One of the muscles will be sternocleidomastoid, which is this, or the trapezius. So one way to test for cranial nerve number 11 is to ask the person to shrug his shoulders like this. Bring it up and down, because the trapezius help us to shrug our shoulders. If you want to test the strength of this, it will be just depressing the shoulders of the person. You will be standing on the back or on one side and depressing it, and ask the person to lift their shoulders against resistance. Another way is to put resistance on the jaw, and ask the person to move their head laterally towards the area where you're putting the resistance, and you do it bilaterally to see how strong it is, the innervation of this nerve on one side or the other. So that's how you test for cranial nerve number 11, or the accessory. Cranial nerve number 12, or hypoglossal. You ask the person to stick their tongue and see if it deviates to one side or the other. If the person has deviation of the cranial nerve towards the right side, that means that the cranial nerve, of the tongue, if you ask it to stick to outside, and then of the oral cavity, and if it deviates to the right side, that means that the left hypoglossal, it is paralyzed, and vice versa. And that's how you test for these cranial nerves. But I omitted to tell you about cranial nerve number 8, which is the vestibulocochlear. This has two portions. It has this cranial nerve. It has one portion that innervates the cochlea in the inner ear, which is related for the sense of hearing. So this is one of the special senses. So if the person cannot hear in one of the ears or both, there might be a problem with the cochlea. Now the way to test it is to use this tuning fork. So you will tap the tuning fork and then put it here in the forehead. And if the person can listen to sound more in one side than the other, there might be a problem with either conduction of air waves or with the actual nerve itself. If it's a conduction problem of the waves of air that creates the sound, there might be a problem in the middle ear or in the external ear. The person might have obstruction of the external ear, or the person's ossicles inside the middle ear might not be vibrating. And this happens as we age. We will have calcification of the middle ear ossicles, and this is known as otosclerosis, and then you don't transmit as many vibrations into the inner ear. So you will do with this tuning fork, putting it in here, but in order to kind of discard the possibility whether it's bone conduction or air conduction, which is the way to test for hearing loss, is by tapping, besides doing this test, tapping to this tuning fork, and then put the edge of the tuning fork here in the mastoid process, and once the person stops hearing these vibrations that goes into the inner ear, tap it again and then put it here like this on the outer portion of the ear, and then ask how long does it take for the sound to stop after you put it on this side of the ear. So if the person can hear the sound longer when you put the tuning fork outside the ear than when you put it here in the mastoid process, that means that the person's problem, it will be in the cochlea, not on the inner ear or in the external ear. And then that's how you test for the cochlear portion of the vestibulocochlear nerve. Now, for the vestibular portion, which is in charge of equilibrium, you can ask the person to walk towards you with their toes being put on the front of the heel, or sorry, the heel be put in the front of the toes, walking in a central line, just like the cops do the test for seeing if someone is drunk. If someone is walking, as you're asking for this test, walking like this to the sides, that's ataxia. That's a problem with the vestibular portion of the vestibulocochlear nerve. So this is then how you test for the different cranial nerves. I will see you in the next video.